Good afternoon, everyone, and welcome to Community Alliance's Housing First Best Practices training. Super glad to have you all here and to be able to provide this training virtually. We are having a series of 6 trainings in person, and those dates will be posted on our website. But for anyone who's unable to make it or just wants to share this training with others at your organization or partner organizations, we're happy to be a resource for individuals who are working to address homelessness in our city. And so today we'll be focusing on housing first, which is a complex approach that can present significant challenges to direct service providers. So we will cover the gamut of housing first. We'll talk about early history. We will talk about kind of the research behind HUD implementation and adoption of housing first, requirements that are necessary if you are a participating organization receiving HUD federal funds, and then the history and practicality of this approach in Memphis. And so again, just happy to have everyone here. For anyone who may be unfamiliar with Community Alliance, we are the HUD funded continuum of care lead agency for Memphis Shelby County, and we bring in over $9 million annually to address homelessness. We oversee that funding and ensure that agencies running our housing programs meet outlined federal requirements. We also provide strategic oversight for our region's strategic plan to end homelessness. So there's always a ton going on. Later in these slides, I'll provide a couple of different resources and contacts. If you have any questions regarding this training or how to get involved with us, please feel free to reach out. We're always looking to build our coalition. And with that, we'll get started. And so here we'll kind of talk about how things used to be and how they have transitioned to what they are now, with this idea of staircase modeling versus the housing first model. So in the 1970s and 80s, we kind of saw this increasing deindustrialization of urban city centers. There was political transition, economic decline, and with all of those kind of combined factors, we saw a large increase in the homeless populations, specifically in urban centers, and organizations were working to mitigate challenges that they were seeing arising, especially in the reoccurrence of homelessness. And so what would have been traditionally where someone who was experiencing homelessness would be placed in an emergency shelter and preceded by transitional housing into permanent housing, the housing first model really took the approach of connecting people directly with stable housing in order to address some of the coexisting factors that may be apparent in an individual's life. So whether that meant addressing sobriety, ensuring employment, dealing with documentation or paperwork, these were a lot of the barriers that were keeping people on the street or out of kind of secure and stable living situations. So in the late 1990s and early 2000s, several organizations, one in New York City specifically, Pathways, worked directly with individuals experiencing mental health challenges and living on the streets, placing them in permanent housing first, and then providing them with those direct supportive services. And this approach really emphasized client choice and client dignity, and led to overall reduction in reoccurrences of homelessness, and increased client choice, and sense of self-determination. And so in the early 2000s, really about 2000, HUD adopted housing first as a best practice and described the model as a proven method for ending all types of homelessness. It is the most effective approach to ending chronic homelessness, and that has been backed up by decades of research that show that clinical prerequisites like the completion of a course of treatment or evidence of sobriety, really do not perpetuate housing stability, and Housing First therefore kind of yields a higher housing retention, lower returns to homelessness, and reduction in the use of crisis services or emergency services. And for the purpose of this training, we'll kind of throw out a working definition of Housing First. Housing First is an approach to quickly and successfully connect individuals and families experiencing homelessness to permanent housing without preconditions and barriers to entry, such as sobriety, treatment, or service participation requirements. So oftentimes, an emergency shelter or transitional housing placement may require that someone gets clean before accessing permanent stable housing. In a Housing First model, we're removing all of those barriers so that a person can get clean. By putting them in a situation where they feel safe, they feel seen, they feel taken care of, we're able to wrap them provide wraparound services that address some of these coexisting factors that may be contributing to a overall life instability. Housing First here, it says, is a whole system orientation and a response aimed at improving health and well-being. It really takes a person-centered approach and sees the individual as an individual who is deserving of housing. Housing, we believe at Community Alliance, is a human right, that all people should be treated with dignity and given housing so that they can succeed in life. Here again, just re-emphasizing the person-centered approach that Housing First takes. Housing First really accounts for the idea that there really is no housing ready. Everyone needs specific and tailored supports, and by having a long list of prerequisites, we may be keeping people from the supportive services they need to find life stability, and that is demonstrated in the graphic below. So where you see that there's multiple fail points in a staircase modeling, a traditional model of housing readiness, where an individual may need to meet certain medical, behavioral, and mental criteria before accessing certain services. There's many fail points where they may relapse into homelessness, but Housing First really emphasizes that by establishing permanency within their home, we are able to address medical, behavioral, mental, income, landlord relationships, and overall produce an increased life stability. Here again, it's just another graphic detailing how Housing First provides an alternative to the staircase model, where sobriety, employment, program participation may have been barriers before. By taking a Housing First model, we allow individuals to move forward and better achieve housing stability in a manner that is determined by themselves and for themselves. And so as in line with HUD's adoption of Housing First as the continuum of care lead agency, Community Alliance emphasizes that at all levels, outreach, emergency shelter, short-term intervention, rapid rehousing, and even long-term supportive housing should be practicing Housing First. And we do understand that there are challenges associated with adopting these practices, but all agencies who receive funding through the COC must incorporate Housing First practices into their policies and procedures for programs. And these policies and procedures are monitored annually in preparation for our renewed HUD funding. If you're an agency who is potentially looking to solicit HUD funding through Community Alliance, and you're curious about how your organization may be already practicing Housing First, or would like to learn more about strategic implementation of Housing First, we're happy to consult on that and help you throughout that process. So the history of Housing First in Memphis specifically has existed for over a decade. And there are currently over 1,000 beds in our community in both permanent supportive housing and rapid rehousing programs that are dedicated to ending homelessness for individuals and families using the Housing First model. There's a lot of factors that we face in Memphis, including high poverty rates and, the increasing lack of affordable housing. Many barriers exist, especially regarding criminal records, which present significant challenges for a system-wide response to implementing Housing First as a best practice. And so, hopefully some of the questions that we present today will help us reflect on ways that our organizations can move forward together to mitigate some of the challenges that we see in our own city. And before kind of getting into a reflective or discussion-based portion of this training, I do want to just kind of take a moment to discuss Housing First on an interdisciplinary level. So across all sectors, whether that be healthcare, education, direct service providers, there is a stated need that individuals have access and opportunity to access stable housing before anything else. We're seeing with healthcare providers every day that individuals are coming into ERs and they are exiting to the street, which is only leading to reoccurrences of injury, poor health outcomes, and ultimately it's just not taking a human-centered approach. And so here we've referenced some research that has been conducted at an institutional level about the impacts of Housing First on healthcare. So, understanding that individuals who have immediate placement in housing really are linked to an incredibly extensive network of supportive services like public benefits, mental health, community health services, participation in addiction treatments, and these benefits only increase as time goes on, and that they remain in these permanent housing situations. At the end of many studies, we're seeing 2 years out, there's overall decrease in use of costly services like the emergency department, hospitalizations, and there's an increased use of primary care and overall increased quality of life for individuals. At the local level, we're seeing that direct service providers are attempting to find ways to bridge the gap between some of these issues, like reoccurrences of individuals entering the ER and exiting to the street through different respite care programs, or even trying to connect with individuals at the hospital, creating positions and patient advocates working to assess housing instability for patients when they come in. But this quote was shared at a focus group conducted by the Community Alliance regarding health care and homelessness. And an individual who's a local service provider shared that daily hospital workers will drop a patient who is discharged off from the hospital and try to leave them at our door to get housing. Individuals must exit the hospital to housing, not to a sidewalk. Unfortunately, this happens every day, and there are not enough agencies meeting the need. We need a careful, human-centric, and trauma-informed approach to meet healthcare needs of people experiencing homelessness. And so this quote, even for me, just really reifies that a person-centered approach across all sectors, across all interdisciplinary work, really is what we as an organization want to see in our city. And we believe that Housing First is one of the many pieces in the puzzle that may transform our city and getting there. But with that said, kind of returning back to some of the challenges that I cited that are specific to our city, what are some of the challenges that exist currently for you or your organization in implementing the housing first model? And due to the nature of this training, being a recording, just taking a moment here, to pause, have a conversation with a coworker, maybe it's someone you're taking this training with. What challenges do you see in your organization, across your organization, in implementing this model? And with that conversation, if anything arises that you would like to continue further, we're happy to continue that conversation with you. Secondly, presenting the question of what are the demonstrated benefits of housing first across your organization's work. Taking a moment here to converse with either a coworker, a partnership organization, someone else in this line of work, to understand what are some of the benefits, and what are maybe positive stories that we've seen come out of the last 10 years of work in our city. Moving forward, I just wanted to present some of the many resources Community Alliance has for individuals who are currently doing this work or interested in getting involved. Again, participation in the COC planning and the affordable housing committees is a great place to start if this conversation, kind of sparks something in you. It's an issue that you feel passionate about and feel like you want to get involved more and kind of get in the know. Those two groups are great resources to just start networking and getting involved with individuals who have been in this line of work and have been advocating for sustainable change for several years. You can anticipate the annual symposium on ending homelessness in the fall of 2023. Specifically, August is the aimed for date. And then, getting in contact with other COC funded agencies. We would love for you to come out to any of our trainings that we'll have throughout the spring in 2023. They're great networking opportunities. It's a great way for all of us to get on the same page about implementing some of these practices that have been passed on as best practices. They really are only best practices when we practice them with consistency and across the board, and just helping one another connect with each other, get to know each other, trust each other. We would love to have you out at some of our meetings to kind of get involved in the greater community. You can always contact the COC Planning Director, Julie, at julie@cafth.org. She is available for technical assistance, and really kind of any needs that your organization may have questions about. Additionally, there's some links here that provide further research on housing first best practices that have been cited throughout this presentation. And with that, I just want to say thank you for your attention. Our next training session will be in person on December 9th, 2022, at Community Alliance's office in the Lipscomb Pitts building. If you would like more information on attending this training, please just reach out to Julie at CAFTH.org. We'd be happy to make sure that you get the invitation. Again, thank you so much for your attention. I hope that this has been helpful. If you have any questions, please feel free to reach out.